What's up, everybody? Peter McKinnon here. I am a photographer, YouTuber, cinematographer. I drink way too much coffee, all of those things. But today, we have a very special video with a very special guest, none other than Dr. Howard New, the Deputy Chief Public Health Officer of Canada. We're going to be talking all things COVID-19, prevention, things to look forward to, things to look back on, how to keep you and your family safe. Questions that you might have, questions that I have, things that have been mixed up. We're going to get some clarity on some of these issues and an overall insight of how we can globally come together and beat this thing. So without me yammering on anymore, let's bring in Dr. Howard New and get asking some questions. Thanks for taking the time to do this out of your obvious, massively busy schedule.
I'll shift the camera a bit. Is that, how's that? There you go.
Look good. You got the YouTube background going and everything.
Yeah.
Did you ever think you'd be adding that to the profession, doctor and now YouTuber?
Never. I think my kids will be impressed.
All right. Well, yeah, thanks, man. Thanks for jumping on. But I thought like what would probably be good is to do like some rapid fire, just like fast questions that everyone has. And then a few kind of longer form things that you can dive into and we can just all listen and hopefully learn a lot and come out of this ready to fight this virus. Okay.
Let's go for it.
Can you get COVID-19 from a package arriving at your house?
I would say generally no, but it depends because of the scientific evidence. It shows that the virus can last from hours to maybe days, but it depends on the surface. So hard metal surfaces, it's possible the virus lasts longer than compared to, let's say, a porous material like a cotton shirt. So for something like cardboard, I would say that the chance is pretty unlikely that it is able to stay on cardboard for a long period of time. But if you're concerned, you can always sort of maybe disinfect it or leave it to the side for a few days before you open it, just to be on the safe side. But I really think compared to things like, door handles, sort of like cell phones, certainly the risk is much less for the virus staying on let's say cardboard.
That's good because we all get a lot of mail. I get a ton of mail. So that was one of my first things was, are all these packages out front of my door safe to touch? What about like fast food and delivery? Driving through a fast food restaurant, having food delivered to your house, is that risky? Should it be avoided?
No, I would say that I think it's very important to support local businesses these days.
Definitely.
So many things going on, and I would say that there's no evidence so far that the virus is transmitted through food. And certainly if, let's say, the restaurant or the fast food establishment practices all the sort of the safe food handling practices of public health that they're supposed to do, then there really is no risk that you order a fast food because you should not get COVID-19 infection, but you should also not be getting salmonella or all of those other foodborne illnesses that you want to avoid. So it's not just the virus, but any sort of foodborne disease.
Anything. That's good. Okay, thanks. That's great. On that note of food, should you be washing all your groceries? I'm here just rubbing down each individual grape, making sure is that needed?
It depends. Like I say, depending on the kind of food, I would say that safe food handling practices apply for COVID-19 as they would have even before. So, for example, if you buy raw chicken, of course you should be, washing your hands before and afterwards, making sure you don't use the same cutting board for raw chicken and afterwards then cutting your fruits and vegetables. So all of what we call safe food handling practices should apply in the case of COVID-19 as they did for every other sort of microorganism. I would say that no extra precautions are required over and above what you should already be doing for all of your food.
Good to know. That'll save me some time at home for sure. Yeah. When I'm leaving my house, should I be wearing gloves and a mask, no matter what?
That's a good one. That's something that actually is sort of, I would say, in play right now. The N95, that's obviously, as you've seen on the news, a bit in short supply. That's very important that we save those for our frontline healthcare workers. So the N95 and others, definitely for those people working in hospitals, other essential workers, they need to have those masks. The whole thinking now is that based on some evidence that some people may be able to transmit when they're very mildly symptomatic or not even aware that they may have some mild symptoms or maybe no symptoms at all. That's the thinking behind what we now call non-medical masks or face coverings. And so the thinking behind that is that if you were to wear a face covering or non-medical mask going out into public, it's not because you're trying to protect yourself from others. It's more about you protecting others from you. Your question about the gloves, though, I would say by wearing gloves, you're more conscious that they're on your hands. So if that prevents you from touching your face or being mindful that you have to be careful what you're doing with your hands, yes, but certainly that's not a protection because with your glove, if you touch a contaminated surface and then you rub your nose, you're just likely to become infected yourself.
Yeah. So you'd also have to take precautions to dispose of those gloves properly.
Exactly.
Because they're just as bad as not wearing them if you touch something. Okay. How about just like going on a walk around the community? That kind of thing should be fine and safe to do for like families that are at home right now, people that are at home just wanting to get outside, exercise. That's safe.
If you're just otherwise well and you and your family need some fresh air, and you haven't, just come back from a travel, overseas, there's less and less of that. But for everyone else, it is, I think, very good to get outside. Practice your physical distancing at 2 meters, and in your neighborhood is fine.
Should you be keeping a certain distance from everyone, no matter where you are, outside or?
Yes, yeah, definitely. Always keep that 2 meter distance, 6 feet apart. What we call is, stay in your bubble and don't burst anyone else's bubble.
Okay. Interesting question here. Can you get this or give it to a pet?
It's interesting. There's actually evidence now, scientific evidence that some animals have actually been able to get the virus. And certainly the evidence seems to indicate that they got it from humans. So I would say at this point, if you actually are worried and you're sick, you should probably stay away from your pets so you don't, take the chance of giving your virus to your pets.
If you've already had COVID-19, you've tested positive for it, coming out of that, are you immune to it, to getting it again?
That is another great question, and the scientific evidence is not clear yet. Certainly for lots of other respiratory infections caused by virus, normally when you test someone, they have what we call, antibodies in their system. They have immunity for a long time, often for life. But this one is such a new virus, we're still learning about it. And
Sure.
Based on studies from other countries, what we call serological testing in terms of looking at the antibodies, they'll test positive in terms of having the antibodies. But then it appears in some studies or reports that these people, the immunity isn't long lasting. And even then they might, quote, be able to get another COVID-19 infection. So it's not quite clear yet. And I would say at this point, certainly there's no clear evidence that anyone who has had COVID-19 has since recovered would be considered immune for life.
That's very informative. Thank you. One of the things that I was hearing a lot, like when this started, you heard everyone saying, the flu kills this many people.
Yeah.
I was wondering from your opinion, like why is comparing COVID-19 to influenza a bad idea?
For one, seasonal flu is around every year. What happens is that the flu strains mutate or change slightly from year to year in most years. And what happens then is that most people will have been exposed to a similar strain of the flu, maybe from a previous season. And therefore, there's always a certain proportion of the population that might have some immunity against seasonal flu, even with the new strain that might come that year. What's happened with COVID-19 is that this is such a new virus, no one in the world had any experience or has any immunity against it. And we can see what the devastating results have been. Is this, what's really, I think, bad about this virus is I would call it a sneaky virus. So in some ways, it might actually be easier if it, some of the movies like Contagion, right? Everyone who comes in contact with the virus dies. So you can easily follow the trail of bodies. Oh yeah, so-and-so, was with so-and-so else and now they're all dead. Whereas in this case, many people get severe symptoms and end up needing hospitalizations. But also many people might have mild symptoms similar to a cold and so on, and they recover. But during the time they have the symptoms, they don't know they have COVID-19. And that's how they spread it to others who knows how they might react to it. Will they have a mild illness themselves, or will they actually get a more serious illness requiring hospitalizations? It is true that older people generally, and those with underlying medical conditions, are at higher risk overall for getting severe consequences and needing hospitalizations. Certainly the data shows that. But unfortunately, if you look at the data as well, a good 30% or so of the case reports we have in Canada are people under 40. There's been a number that have actually died as well. And then what's really interesting as well is that they may be anecdotal, but there are reports of perfectly healthy young adults, even people who are very physically fit, exercise every day. And they say, wow, when they got COVID-19, that was one of the worst experiences in their life. They could hardly breathe for days and weeks, and even weeks later, they were so weak they could barely climb a set of stairs, etc. So it's something I think everyone needs to take seriously.
Yeah, you see a lot of young people right now caring, I think, less about it based on the fact that I'm 30 to 35, I work out every day, I eat super healthy, I'm 100% immune to this. And even if I get it, it's not going to be bad. I'll be able to fight it off, no problem. But then you are seeing reports, like you just said, of these young people just getting fully knocked out.
You may be healthy and so on, but how an individual's immune system reacts to this virus really varies, and no one is able to fully explain why some people, like you say, perfectly healthy, might have quite a serious sort of a result of getting infected with this virus. And so I think it behooves everyone to take it seriously. You don't want to be that one person in whatever number of group of people that ends up seriously ill and needing a ventilator in an ICU bed.
So you're on the front lines of this. How's Canada doing compared to other countries right now?
I think we've been somewhat fortunate in Canada because we've been able to learn from the experience in other countries where obviously the virus sort of propagated through the population earlier. Based on that, I think we've been good overall. I think many of the measures we put in place in Canada in terms of physical distancing were done early enough that even now we're starting to see some of the benefits. If you look at our so-called epidemic curve here in Canada, I want to be optimistic. I would say we're starting to bend the curve. I wouldn't say we flatten it to where we're starting to bend the curve, even though the data and the case reports are encouraging. We have to remember that what we're seeing today in terms of the data is actually the result of actions or activities that we all did about 2 to 3 weeks ago. So whatever we do today, good or bad, we're going to see it in terms of case counts, et cetera, 2-3 weeks down the road.
That's what I'm concerned mostly about in hearing the optimistic news. And I think a lot of people everywhere eager to get outside, eager to get back to work. The second we see a glimmer of hope, I'm worried that everyone's just going to jump back into things because we're just itching to. My question is, like, how fast could that just be immediately reversed if no one practices these things? Like right now, still, even if you're feeling positive, stay inside. Don't bother, like, publicly. Don't non-essential businesses. So is that something that could happen quickly and just revert back?
Unfortunately, the answer is yes. Our early estimates, and also from other countries, is because no one in the population is immune. So the so-called attack rate could vary from anywhere from 30% up to 70% of the population. So if we actually let go and let people just sort of go back to their normal activities, it could change very quickly. One of the things we looked at when we were quite worried, let's say a number of weeks ago, was the so-called what we call doubling time. How many days does it take to, double from 10 to 20 cases, then 40, from 100 cases to 200 and so on. And at one point, the doubling time for cases in Canada was in the order of about 3 days or so. And that was pretty bad. Now I would say the doubling time in Canada is more in the order of greater than 10 days. So see, we made quite an improvement from, a doubling time of 3 days or so, and now we're over 10 days. So we want to keep that up.
Yeah. And if this comes back again, like in the fall, is this the kind of thing that's potentially going to? And if it does it come back with a vengeance? Are we looking at this as like the warm up to the main event, which could happen in the fall? Like, is that something people should be stressed about, mindful about in their actions today and moving forward?
This obviously has started in January. Of course, this was our winter season here in Canada, but also our flu season. Part of the challenge was distinguishing between people who might have had the seasonal flu and people who had COVID-19. Fast forward to the fall in our winter season, that really is a worry. And I would maybe make an early plug now. Hey, everyone, think seriously about getting a flu shot this fall, because we don't want our hospitals to be overloaded with patients who are ill with both COVID-19 as well as seasonal flu.
Looking into like a bit of your background and stuff, knowing you've been involved with the response to a lot of outbreaks like SARS and H1N1, SARS being a coronavirus, I'm wondering, like, what have we learned from that, and how has that helped us in this current situation dealing with COVID-19?
After SARS, the World Health Organization had a process. I was actually involved in that in terms of what we call the revision of the international health regulations. So that is sort of the only framework that exists that still is in play now. Here in Canada, certainly we had a tough time during SARS, and a number of good things came out of that. And the agency in which I work now, the Public Health Agency of Canada, was created out of the SARS outbreak here in Canada. We recognize that we need to have sort of maybe a singular voice that can speak to Canadians with authority. And that's why the position of the Chief Public Health Officer was created. And Dr. Tam is the current Chief Public Health Officer, and I'm her deputy.
Looks like a lot of stuff came out of that that's helping us now dealing with this. This is something that I've been curious of. Looking up symptoms of COVID-19 when it was kind of, I want to say, first hitting the scene like a month and a half ago for us, I find that there was less of them. Dry cough, fever, stuff like that. Now when I look them up, I'm seeing stuff like vomiting or diarrhea. It almost seems like no matter what you're feeling outside of normal, it could be COVID-19.
With many things, the scientific knowledge evolves over time. So you're right, at the beginning, what seemed to be the classic symptoms of a respiratory infection, the cough, the fever, the shortness of breath. But as we got more and more people diagnosed with COVID-19, you're right, quite a number of other symptoms came up. People complaining of headaches, feeling off. Even some people complain of losing their sense of smell
and taste,
and also taste and so on. Anytime someone feels a bit off or not quite right, I think at this point should be sort of considered as a possible infection with COVID-19.
The first thing that person should do if they do think they have it, what source do they go to see like the symptoms? And then two, what's their first course of action? What are they doing? Where are they going?
Okay. I would say two things. First of all, there's some great what we call self-assessment tools. I would point people to canada.ca. We've got great tools there, including a self-assessment tool, as well as there's lots of great apps on the smartphone. And we've got the Canada COVID-19 app you can download, do a self-assessment if you're feeling off or ill. And if you actually do the self-assessment, certainly it looks like you might have it. Then the next thing I would advise is that you need to know the number of the local public health or local health authorities and call them and get direction as to what you should do, where you should go in terms of seeking a further attention.
Okay, that's good to know. Okay. Can we look forward to any type of vaccine timeline? Because obviously that's something that's being worked on, I would assume, furiously around the clock.
Don't want to sound either too optimistic or too pessimistic, but certainly based on what we know and also development of vaccines for other infectious diseases would probably be in the ballpark of about 12 to 18 months. And that's really to a time that you could actually, what we say, have a vaccine that's been shown to be safe as well as effective, has gone through all of the appropriate, what we call clinical trials, and then is ready for to be, as I say, approved by the regulators, and then obviously then produced on a mass scale for the general public.
Okay, 12 to 18 months. So I guess they need that time to make it work properly.
Yeah. What we have is the measures like physical distancing and so on. But I would say that now governments, including ourselves, if we're hopefully bending or flattening the curve, we could maybe start looking at, and we're also going to take the experience from other countries, are there maybe certain public health measures we can relax? And we still need to maintain our physical distancing, but there might be certain types of activities or businesses that, depending on the construct, that might be able to be, quote, reopened or would permit people to hopefully get out and do more than what they're doing now, which hopefully is staying at home.
Yeah, sure. Get back to things. And the key is slowly and in due time. And that kind of brings me to like, you keep seeing that hashtag and people talking about the new normal. And we touched on it earlier. I was kind of thinking like, what do you think that means? Like, will Canadians as a whole just be entering like a new way of moving forward based on these recent events? Like, can we expect protocols across all industries to change?
So quite a few things you can talk about in terms of the new normal. I would say that businesses, government included, are looking at is that what is the right balance in terms of now what working at distance or teleworking and so on. So I think there's always going to be a place maybe in the future for people to have to get together physically. We are social beings, right? That we can't just all be working remotely, have that FaceTime, like real FaceTime rather than just virtually and so on. Depending on the requirements for your company, certainly teleworking, I think is a viable option. I think that's going to be expanded or refined in the future. So that might be part of the new normal. Other things as well in terms of how do we get around in terms of how, let's say, public transport is designed and sort of put in place. That those are other things to look at. One of the other things, the use of non-medical masks. Culturally in let's say many Asian countries, if you're sick with a respiratory infection, it's normal practice to wear a face mask in public. Now we're just new to this, but who knows in the future, there might be a legacy in terms of a normal practice for everyone to go in public with, let's say, a non-medical face mask if you have a cold. And then I think a final part of the new normal is I think people are starting to appreciate the importance to the extent that it's feasible and people are willing to, let's say, do or pay maybe a bit of extra for being self-sufficient. For example, with the mad rush globally now to get personal protective equipment, those famous N95 masks that are made in other parts of the world. We're also looking at domestic capacity to make sure that we have that type of essential medical equipment being made here in Canada, so we could always, quote, have that stability of supply. But then if you look at being a self-sufficient, to what extent in terms of are people ready to maybe pay a bit more or whatever, but support local economies, but also it's easier in terms of getting food rather than worrying about where it's shipped from around the world. So those are kind of some of the things I'm thinking about that might be part of, quote, the new normal moving forward.
Do you think this will have an impact on just the mental health of a lot of young people and just people in general while we've been in lockdown? Like, you think it'll impact mental health, and is there things we can do to, mitigate that?
Certainly self-isolation and so on is putting a lot of stress on people. So I think that in the short term, I think there's lots of things people can do in terms of their mental health. There are various numbers or resources online, phone lines, chat lines that people can avail themselves of in terms of having someone to speak to. Certainly, I think in terms of long-term, in terms of mental health services supports, those are things that we need to also think about. But I think overall, especially for young people, I think young people are pretty resilient. As my kids tell me, in a certain kind of tone, you say, it is what it is. So you just got to deal with it. That's one of the things that I think young people are good at. You deal with the situation and you move on. One of the things I will mention, though, I think it's something maybe not so much for young people, but all of us are eventually going to get old. So I think there's going to be, a big national conversation at some point in terms of how do we deal with our older generations in terms of, nursing homes, and how do we make sure they have the right supports, and even the healthcare workers taking care of them. Some of the issues obviously coming up right now. We recognize we need to think about those types of settings, as well as our other vulnerable populations, for example, the homeless and so on. So those are things I think the young people of today, I think hopefully in a good way, see these challenges and hopefully maybe take them on as their own, and being the people to solve and deal with them in the future.
That's great. Well, you are no stranger to interviews. You smashed this. You would be an excellent YouTuber. So
thank you very much.
I wanted to thank you for all the extra time and effort that you've been putting in, obviously, over these past months to keep everyone safe. It's an exceptional role that you're playing, and it's very much appreciated.
You're very welcome.
And I also wanted to your title. You are Deputy Chief Public Health Officer and Chief Medical Advisor, Infectious Disease Prevention and Control Branch, Public Health Agency of Canada.
I'll just go with Deputy Chief Public Health Officer.
Well, man, thanks for taking the time to chat.
You're very welcome.
I think you'll have helped a lot of people. Thanks so much.
Okay, thank you.
So that's it for this video, guys. Thank you so much for watching. A very special thank you to the Public Health Department of Canada and Dr. Howard New, all the work and effort that you are doing, and all of our frontline professionals, medical professionals across all fields, putting in the time, putting themselves at risk on the front lines every single day to keep Canadians safe. Thank you. Sincerely.